My name is Pam Wycliffe, and I welcome everybody who is here for Lunch with the League, August the 8th. And I have some words that I need to say at the beginning here. We, as the League, we never support or oppose a political party or a candidate. We're a nonpartisan political organization. We encourage informed and active participation in government. Our roles are: one, voter services and citizen education, getting information out about elections, the voting process and issues. And we register voters too, and help them check their registration to make sure that they're always registered, because sometimes people get purged off the list. And we also, after study of an issue, we use our position to advocate for or against particular policies in the public interest. So therefore, the comments and the opinions of people who speak today aren't necessarily those of the leagues. They're their own. Our general format is for the speakers to speak for about a half hour, and then we'll have Q&A for a half hour. We'll see if we can fit all that in. I don't know, but we'll try to fit all that in. We end at 1. And please remain muted during the talk. Put your comments or questions in the chat. And I didn't mention this to anybody, Dr. Migliore. I don't know if you all are going to want to pull the questions from the chat, or if you want me to mention it and then you answer it. You might want to tell me that.
We can is it okay if we answer the questions at the end of the
No, we will. Yeah, okay. No, that's fine. But I ask people to put their questions and their comments in the chat. And then sometimes people will want me to read that to them, and then they answer it. Or you can decide if you want to read it yourself.
No, it's fine for you to read them to us so that everyone can hear. Okay,
that's good. If people need to know more about or want to know more about the League of Women Voters, they can go to League of Women Voters southbend.org to find out what our local folks, our local chapter is doing. And it also will have a link to the Indiana chapter and also to national. And you can find out all of the information about what they stand for, and what their issues are that they are working on. So there's a lot of information there. I have a few things that are local that I need to mention. One is
Pam.
We will have 2 places that we will be: library.
Can you say that again, because you were frozen for a sec?
Oh, I'm so sorry. I better say it all really fast because I'll be frozen again pretty soon. National Voter Registration Day at the South Bend Library, the main branch at Community Resource Center through that door from 12 to 2. And we'll also be at the Penn Harris Madison Library, the main library downtown in Mishawaka, from 12 to 2. We can register voters, we can check people's registrations, give them information if they have any questions about voting.
And it's September 16th, correct?
I did say that, yeah. Okay. We've already been to 1 school. We're heading out to 2 other schools in the next week, and to St. Mary's College. The other thing is this is for the members. There's a new member party at O'Rourke's Public House. I forgot the start time, but at 7:30 you can pick up your t-shirts. The league t-shirts, our new t-shirts.
The start time is 6:30 if you want to come in time for the orientation of the new members. But if you just want to come and hang out, 7:30 is great.
Okay. And watch for updates from the Indiana League of Women Voters and the national for alerts to respond to issues, to things that are coming up that they need emergency or short-term emergency responses from its members to Congress, to our state, to whatever's. And now I'm done. I'm out of words, and I'm going to leave it up to Cynthia and to our team of presenters. And thank you all for being here.
Thank you so much, Pam. I echo the welcome to this September 12th League lunch. And I'm going to, out of consideration for time, turn it directly over to Dr. Migliore and her wonderful team.
Thank you very much. We appreciate being here. I'm Dr. Michelle Migliore. I'm the health officer. I started this position in the summer in June of 2024. And I have a wonderful consultant, Dr. Diana Purushottam, who stayed on as a consultant. She's our previous health officer, and she stayed on as a consultant to help us navigate the ever-changing world of public health. We have 4 members from our team here today to talk about their areas of expertise and educate you about some of the things that the Department of Health is doing. So without further ado, we'll be starting with Ashley Helman. I'll let her introduce herself and tell you a little bit about herself and her team. And I'm moving to advance the slides. Thank you.
Hi, thank you so much for that introduction, Dr. Migliore. I am Ashley Helman. I'm the Director of Nursing at the department. And I know our time is a little precious today, so I will just say our department does multiple things, and I have the opportunity today to talk about 2 areas that you can learn about and then also help support improvement in our county. So thank you so much for your time today. I am going to talk about vaccine rates and about our community partnership program. And so let's start with talking about vaccines. Right now, we are working in the county on improving our vaccine rates, and we are very focused at the health department on completion of the primary series of vaccines for kiddos under age 3. And starting out with a little bit of bad news, we are currently 75th out of 92 counties for on-time series completion, and that is not good. But there are ways that you can help to improve that rate. So next slide, Dr. Migliore. As parents, grandparents, or caregivers, we encourage you to make sure that your children are up to date and that you are encouraging family members to make sure that their children are up to date on their vaccines. One small, easy way to support vaccine rates. Use trusted sources and encourage people that you know to talk about vaccine questions with their pediatrician, the Department of Health, online sources like the American Academy of Pediatrics, just to make sure that vaccine information is accurate, up to date, and that they are able to have a conversation. And then if you've had positive experiences with vaccines, share that, because personal stories can be very impactful and powerful. Then as community leaders and advocates, you can help host or support immunization events. We have a mobile team that goes to schools, libraries, churches, community events. And our goal is to have vaccines available in places where it might be hard for people who live in those areas to access the traditional medical system. So we would love to partner with you to find more of those places where we can work. And then use your influence in those same places, clubs, churches, civic organizations, to make vaccine access and awareness part of the conversation. So we know if we can't have a conversation, if we can't have a discourse, then we're never going to move forward. So it's so important for us to have conversations with people that we agree with and with people that we may not have the same views as, so that we can understand where everybody is coming from and help to move our conversations forward with whatever that looks like. And then if you are not a parent, or maybe you don't see yourself as an advocate, I know that you see yourself as a voter, and you are definitely a neighbor. And so support public health funding and policies that make vaccines affordable and accessible for all families. Talk to your legislators and let them know that public health funding is important. We have seen a huge impact on our health outcomes in the state of Indiana with the public health funding that has come from HFI, Health First Indiana. And we know that there will be another budget set in a few years, and we want constituents to let their legislators know what is important to them, share that public health outcomes are improving from some of the work that we're doing at the department, but from a lot of work that's happening all over our county. And so if you can be in contact with your legislators. And then as neighbors, if you know somebody that maybe doesn't have access to vaccines, maybe they don't have insurance, if you can share resources, that's one of the reasons we really appreciate being here today, is to be able to say, at the health department, we vaccinate children irregardless of their insurance status. So we are one resource, but you're going to hear from someone from our community health team as well. But our community health workers help connect people to insurance in Medicaid in Indiana. And so there are so many things out there, and we just want people to know that they're available so that we can support them utilizing them, because that is our main goal in the end, to make sure that people receive healthcare that is super important to their well-being and to the well-being of our community. So I'm going to take off my immunization hat and I am going to put on my school health hat, and I'm really excited to talk to you about our community partnership program. And Dr. Migliore, you can just leave it on this slide for a while, and then I will tell you when to scroll down past a bunch of other slides. But I'd like to tell you about my daughter. She had a medical issue when she was in kindergarten. It caused her bladder to rupture. And one of the complications of that was that she had a lot of bathroom accidents at school. And for us, that wasn't a big deal. So we sent a lot of clothes to school. We sent wipes. And every night she came home and she had a bath. And I did not realize at that time what a privilege it was to have access to all of those things. And we learned that not everybody does. And how we learned that was through our school liaison program. So our school liaison went out. We have over 100 schools in St. Joe County, and they talked to people providing care in schools. So that might be a health aide, that might be a nurse, that might be a parent volunteer. But they talked to them in person about what barriers they had, what they saw, ways that they needed support. And we were surprised to hear that, not only are nurses caring for physical health in the nurse's office, but they also are taking care of all the kids that have a bathroom accident, kids who have hygiene issues, and that access to basic supplies are keeping kids out of class and in the nurse's office. So schools don't have funding for hygiene products and clothing. Many times school staff are using their own funds for that. And even that's not a long-term solution. So when those funds run out, they are trying to get in contact with a parent. A parent has to have access to a phone during the day, which may not be something that they have. They need to have access to transportation, and they have to be able to bring the item to the school. And a lot of parents can't do that. Again, that is a very great privilege to be able to do that. But if kids had a parent who could not do one of those things, then the child stays in the nurse's office until it's time to go home. And that can look like an entire school day spent in the nurse's office. So the kids aren't absent, but they're not learning. And we found that it would take such a small intervention to fix that. So we live in a really generous community, and there was a willingness to support school-age children, but there just wasn't a program to connect that willingness to support to the schools. And so that is why we created the Community Partnership Program. And our partnership program combines the generosity and donations from our community directly to the school health offices. Our items fall under 3 broad categories of need, or I'm going to talk about 3 of the categories today. hygiene, 42% of high schoolers will miss school because of a hygiene issue. Menstrual supplies, 84% of women have missed a day of school because of lack of supplies. And then clothing. And Brene Brown said it best, underwear is something that you take for granted until you don't have it. So those were the broad areas that we learned from the schools and from the research that support was definitely needed. And the good news is that you can make a tangible difference. And Dr. Migliore, will you just scroll down to the slide that says 3 ways that you can help? Okay, and I am going to put a link. Perfect, thank you. I am going to put a link to this wish list in the chat, but we have 3 ways that you can plug in and support this program. Number 1, just from your couch, you can get on our Amazon wish list. You can click to add things to the cart, and then they get sent directly to the Department of Health. We take those items and we share them with schools. The schools request them and we distribute them throughout the county. All schools have access to this program. You can do a collection drive and collect items specifically in the area that you're interested in or in our areas of greatest need. You can collect money and buy those items, whichever way. We always need pants, a little thing for that. But and if you are not able to support us materially, that is okay too. Help connect us. We want to tell more people about this program, and we want to make sure that people know that it exists because we do have an awesome, generous community. I am giving you like the 5,000-foot overview because there are some amazing ladies who are going to tell you some other awesome things that are going on, but I'm always happy to talk more privately and give you a lot more information, talk about specifics. I'll also drop a link to a 1-minute video about the program in the chat. And just so you know, last year, 82 schools utilized this program out of 102. And I just strongly believe that our community is as big as we make it. So thank you for your time today. And yeah, if you have any questions, reach out to me.
Right. Yeah. Hi, can everyone hear me?
Yep.
Okay. I am Chaquisha Jordan. I am a registered nurse and I am the Maternal Infant Health Coordinator here at the Health Department. Today I will be talking to you all about our EMBER program, which stands for Empowering Moms and Babies Through Education and Resilience. Next slide. Just a little bit more about me. I do have a bachelor's in healthcare administration. I'm a member of AWHONN, the National and the State Public Health Association, Postpartum Support International. So a couple of different organizations, and I also serve as well on the County Fetal and Infant Mortality Review Committee. And I have 3 babies of my own. Next. So EMBER is this program that we started a year ago, a few days ago. We just made our 1-year anniversary, but this was our response here to some maternal health cafes that were done some years ago with the health department, where different moms in the community were gathered and asked different questions in regards to their pregnancy and postpartum period, what they felt like they need in order to be supported. And so we compiled all of that information and some current trends in the health outcomes in our county to develop this program. Oh. Is that one? Go over to Teams.
It's still showing.
Teams. Oh, not that one. Oh, but that works too. Either way.
Is this what they're saying though? Your
Oh no, the
screen
screen sharing is paused.
paused.
So go.
There we go. There we go.
Okay, can you all see the slides?
I think they're muted. Okay.
Oh, are they muted?
Mhm.
Oh, okay, sorry. So the basic areas that came out of that response from those moms were that they needed more prenatal and postpartum care, mental health check-ins and peer support, support in general for parents and connection to community resources, and a lot of stigma reduction and health education. So what to expect during pregnancy and postpartum, what does that perinatal mental health look like, not being ashamed to seek treatment, things like that. And so we use these 4 pillars basically to anchor our program. So we designed EMBER as a 2-part program. So we have the health education classes. This year we made it a series of 13 classes that rotate quarterly. And then we do offer that's every single Tuesday evening. The classes are completely free. They cover different aspects of pregnancy, postpartum, how to take care of mom and baby after birth as well. And in addition to that, we offer a peer support group that is led by a local doula. That's twice a month as well, immediately following the health education classes. And it gives the moms a chance to bond with each other, share any struggles that they're going through, and be able to have the support of the community that we've developed. So just in general, these are some of the categories of the classes that we do. So we talk about a lot of moms' physical health, but before pregnancy, during pregnancy, how those can be managed, because we know that that is a great effect on the baby's health is what mom's health is. So it's a big factor in the perinatal risk. So managing your pre-existing conditions, if you have any, recognizing warning signs during pregnancy and postpartum, what to eat, what supplements you need, what to expect during the labor and birth process, but also taking care of yourself, stress management, education on maternal mental health conditions, how to get support for those, and then just how to access a lot of basics. So one of the things when the moms were mentioning in the cafes that they didn't know about local resources. Well, we also know that the social determinants of health have a really, really big effect on mom and baby. So mom is not going to be able to focus on going to prenatal appointments if she's worried that her electricity is going to be cut off, or if there's a safety concern at home and things like that. So we give information in general. We also have community health workers that are always available at the classes to assist. And we also bring in some community organizations to talk about the programs that they have and how moms can access those. And then as far as with the baby in particular, we have a really big push with our Safe Sleep campaign, which is giving baby room to breathe. We do focus heavily on immunizations. We have partnered with the immunizations, the mobile unit, to be able to offer vaccinations on site to moms and their support people and babies as well right after class. So to make that as convenient as possible. For car seat safety, myself, as well as we had 2 other staff members that are certified car seat techs through Safe Kids. And so we want to make sure that we are providing the most amount of services. So we do a lot with our little staff that we have, but just in general, letting mom know that you have support with caring for you and baby. So the EMBER program, it is open to all women in St. Joseph County. One of the things that we encourage, even if a woman is not currently pregnant, if you are thinking about becoming pregnant within the next year, or it's a possibility that you could be pregnant in the next year, we encourage them to come, because especially the conditions that we talk about, if you don't currently experience those, or if you do have pre-existing conditions, we do have a segment where we talk about preconception and interconception care. And so making sure that you have the resources that you need connection to healthcare providers to try to minimize as many risks as possible so that when you do become pregnant, that you can have a healthier pregnancy and postpartum period. Again, as I stated, all of the classes, the peer support groups, all the educational materials, everything that we provide are completely free to participants. They currently receive baby coupons and diapers, and we also do monthly raffles for our class, and then quarterly for the support group. So we try to encourage them to come, bring your support people as well, because the education is good not only for the mom, but also for anyone who is going to be surrounding mom. You know, a lot of times your support person may catch changes in behavior or changes with your body that you may ignore. And so they're also good advocates for you as well with the providers. So we do encourage them to register in advance, but we will take them as walk-ins as well. Currently, we have limited transportation assistance, but in some cases, it may be available. And then one of the big things that we do at the beginning and end of each class, we have the participants complete a survey. It's usually about 5 questions. It's the same questions at the beginning and the end. We use that to gauge how much knowledge that they've gained during the class, and they also have the opportunity to leave any feedback for things that they may think needs to be changed or anything like that. And so we use that to tweak our process. And one other thing I wanted to note, we do offer accommodation for both English and Spanish. So the materials and everything are available in Spanish as well.
Spread the word.
Yes. So we encourage everyone, even if you're not pregnant, if you have a child, a grandchild, a neighbor, someone you see in the store, let them know about the classes and the support that we do offer. This is just one of the programs that we have to support pregnant and postpartum moms in our community. So we do have flyers available, digital, printed. So if you all would like some, we can definitely get those to you. And I think it's just, we'll hold the questions till the end. But this in general is our contact information. So that is it.
Whoops, I'm going too fast, sorry. I think that's the first one, yeah, okay.
Hi, everyone. My name is Michaela. I am the lead program coordinator here at the health department. So I'm going to talk about our lead program, looking at lead here specifically in St. Joseph County. So for those who do not know what lead is a naturally occurring toxic metal that competes with calcium and iron in the human body, and it can cause irreversible damage to the brain and to the nervous system. So it can cause things such as stunted growth and development, speech and hearing problems, and behavioral and learning difficulties. And lead is especially harmful for children ages 6 and under because during this time in their life, they're still growing and developing. And also during this time, they tend to exhibit hand-to-mouth behavior. So this can cause them to, unfortunately, unintentionally ingest or inhale lead dust. Like I said, lead is naturally found here on Earth. It's actually naturally found in soil. So it's always going to be present with us. However, lead can also be found in other items, such as in paint in homes that were built before 1978, in dust, pipes, cosmetics, toys, and pottery from other countries, and among other items as well. It is estimated that about 80% of homes here in South Bend have lead in them, and about 70% of homes here in St. Joseph County have lead in them. So you can see it's quite prevalent here in our community. So therefore, it's really important that we continue to address this public health issue here in our county. So looking at testing and reporting requirements for lead here in the state of Indiana, for testing, we have the Universal Screening Law. This became effective back in January of 2023. And this law requires all Indiana healthcare providers to confirm that all children under the age of 7 have been tested for lead. And if they have not, they are supposed to offer that testing to them. It is recommended that children should be tested at their 1- and 2-year-old child checks. However, testing can be done for a child at any time if they are between the age of 3 to 6 and they have not been tested previously. This universal screening law, it is really important, especially for us here at the health department specifically, because it has allowed us to identify children who have lead poisoning that we wouldn't have known about without this law being in place. Because lead can actually be asymptomatic for a lot of children, so they may not show any symptoms of lead poisoning at all. And the only way to truly know if they do have lead poisoning is to get them tested. So this universal screening law is extremely important and for providers to continue to abide by and to continue to test all children who are eligible. And then looking at reporting these lead tests that they do, Indiana statute requires that all blood lead tests, regardless of the results being elevated or not, they are to be reported to the Indiana Department of Health by the entity who examines that specimen. So whether that be the clinic or the lab that does the test, no later after than 1 week after the test has been completed. So it's great that these tests are being done. However, it's really important that providers know how to report these lead tests, because if they're not being reported to the state health department, it is not being reported to us here at the county level. So therefore, we're not going to be able to provide that education to the family. We're not going to be able to provide that risk assessment if we are not aware of it. So it's really important that providers are aware of how to test for lead, who they should be testing, and how to report those lead tests over to us. Move on to the next slide. So looking at our multi-unit lead structure here at the health department, I feel like lead is a really unique program that we have here, because we have 3 different units at our health department that work together here on lead. We have our nursing unit, our community accesses, resources, and education unit, and our environmental unit that work together. So in our nursing unit, we have our lead coordinator, which is my position. So I receive all elevated lead cases from the state, and then I will assign that case to either a public health nurse or one of our community health workers. And then I'll follow up with all the healthcare providers for those children who have elevated lead levels to ensure that they are being retested for lead properly. And then we have our public health nurses. They complete case investigations for lead results that are greater than 10. And then in our care unit, we have our community health workers. They complete case investigations for lead results that are less than 10. And they also perform community outreach with hosting lead testing events, which I'll get into here in a little bit. And then in our environmental unit, we have our licensed lead risk assessors. They conduct free lead risk assessments in these following home environments where children under the age of 7 live or visit frequently, where pregnant women reside, and where a lead poisoned child has already been identified. So that's kind of what our lead program here looks like. So now looking at case management, which is a state mandated program that we have to follow. If you look at the screen, you can see that there's a chart on the left-hand side. This was actually developed by the Indiana State Department of Health. It shows the childhood blood lead level care and case action guidelines for when a child does have an elevated lead level. So a child is considered to be elevated at a level of 3.5 or greater. And once that child gets a blood draw that is greater than a level of 5, that they're considered to be in case management. So like I said, this is state mandated. And once a child does reach that lead level, we are required to perform a home visit by one of our community health workers, our public health nurses, and one of our risk assessors. So this home visit involves a nutritional assessment of the child, a developmental assessment of the child, lead education provided to the family, and a risk assessment of the property. After all that has been completed, the child will need to be retested based on state guidelines that you can see here. Like for instance, when a child typically has a lead level of 5 or greater, typically they're retested within 3 months. But let's say if they have a lead level that's greater than that, like a 10 or a 20, then they may need to be retested sooner. And you can see on that retesting schedule, you can see exactly what that looks like. But we would like them to be retested based on those guidelines that you see on that chart. And then in order for them to end case management out of our program, they must have 2 consecutive lead levels below 5. So we want to make sure that they're actually continuing to decrease rather than decrease a little bit and then go back up in their lead level, because we see that sometimes if they're continuously being exposed to lead. So we really want to make sure that they're continuing to decrease in their lead level. And then looking back at the risk assessment, like I mentioned, that's part of the home visit. After the risk assessor tests the paint in the home, takes some dust wipe samples and soil samples and water samples. After they compile that data together and send it over to the property owner then has 60 days to make the complete remediations in the home, whether that be complete abatement or not. They must do it within those 60 days. And then after they have completed those remediations, the property must pass a clearance exam. So that's when our risk assessor goes back out to the home and ensures that that work was actually done. And they'll take additional dust wipe and soil samples to ensure that those lead levels in the dust and in the soil are no longer at a hazardous level. So looking at our lead poisoning prevention initiatives that we have here at the health department, the first one that we have here is our lead 3x3 initiatives. This initiative that we have aims to make children here in St. Joseph County lead-free by the time that they are 3 years old through testing and removing exposures. And this directly relates back to the universal screening law that I mentioned earlier, how we recommend children get tested at their 1 and 2 year old child check. So we want to make sure that we identify it early in their childhood, because as when they're younger, obviously they're gonna get more damage to their brain and to their nervous system if they're exposed sooner on. So we want to catch that sooner rather than later. And we want to make sure once we do identify it, that we remove those lead exposures in their home. Then looking at our pre/perinatal lead program, this program detects and eliminates lead exposures in the home before the child is born to prevent lead poisoning. So in our care unit, we have our prenatal lead program coordinator. She has pregnant mothers fill out a survey to see if they are at risk of lead poisoning, and to make sure if they are, that we identify those and we make sure that those hazards are removed in the home so the baby is not exposed to that once they are born. And then our home risk assessments, like I have mentioned previously, we offer free risk assessments to St. Joseph County residents who are pregnant and or have children under the age of 7 in their home. The child does not have to have an elevated lead level for them to do a risk assessment in their home. While, like I mentioned before, if they have a confirmed lead level over 5, we're required by the state to do that. However, if they have a lead level that's less than 5, or if they don't have an elevated lead level at all, but they have a home that was built before 1978, we'd be more than happy to do a free risk assessment for the residents, just to make sure that there is no lead hazards being exposed in the home to the child. And then next, looking at community outreach, like I mentioned, our community health workers, they are trained to provide free lead screenings for children under the age of 7 at lead events that we host throughout the community, and also at community hosted events that we are invited to. So our community health workers, they try to outreach to every daycare and preschool in our areas to try to test kids who are eligible for lead testing. We want to make sure we try to hit every kid possible. Obviously, some kids, they may not have the ability to go to the doctor because they don't have insurance or things like that. So we want to try to hit every kid possible to make sure that they are tested if they are eligible to do so. And then a clinical provider outreach. This is something that we have started doing within the past year. We have been meeting with local healthcare providers to discuss the importance of lead testing and reporting. So when I meet with them, I talk with them about the universal screening law, how they should be, when they should be testing children, and how they should be testing them, and how to report those lead levels to make sure that we are receiving that and that we're all on the same page with each other on follow-up testing, and just making sure that we are putting the health of children when it comes to lead poisoning as a priority.
All right, so my name is Jessica Dilling, and I am an environmental health specialist with our environmental unit here at the health department. And I'm going to just share a little bit about Radon and the newer program that we have established, the Radon Free Homes Initiative. But let me just share a little bit of background information on radon. Just like lead can be found in soil and is everywhere, radon is as well. It's all over the world. It originates in soil, and it's basically from the breakdown of uranium. And what happens is that it's invisible, it's odorless, and there is absolutely no way that you know it's there and what kind of level unless you test for it. It's also measured in picocuries per liter of air, which I will get into why that's important in a little bit. But that's just basically some characteristics of radon, is that it's literally everywhere in the soil, and it potentially will affect everyone. And here in St. Joe County, it's prevalent, more so prevalent than in most areas elsewhere in the country. So that's why it's really important to know about. You can advance the screen. So why it's so important to know about is because even though it originates in the soil, it seeps into your home. And because it's odorless and colorless, you have no idea if it's there unless you test your home. So basically it breaks down in the soil, and it can seep up through your crawl space, your slab, your basement. It goes through floorboards that maybe have an opening, sump pump openings, any kind of piping that goes down, any kind of opening that air can seep through. It can go into your house and it gets trapped there. There's nowhere for it to go. And so it accumulates over time. And if the levels are high enough, it's really very harmful. It leads it can lead to lung cancer. And in fact, about 21,000 people per year in the United States die from lung cancer that has been contracted because of radon exposure in their home. So it interacts with your DNA, it changes it, it can develop into lung cancer. And so it's really important to be able to know about it and know how to prevent it because it's found in homes everywhere. And especially if someone smokes and lives in a house with elevated radon levels, it's a really deadly combination because there's a synergistic relationship between radon and smoking. Because basically smoking is the chemical damage that you do to your lungs when you interact with nicotine. And radon is the radiation damage to your lungs. And so if you combine those two exposures, you're a lot more likely to develop lung cancer, and especially if you smoke inside. So smoking and exposure to radon is a really deadly combination. And going back to how radon is measured in picocuries per liter, if a home is tested and it's at a level of 4 or above, the EPA recommends that that home gets a remediation system installed so that the radon is not dangerous and it gets funneled out. But just to give you an idea, if you do test your home and it's at a 4, which is the action level, that is the equivalent of you smoking 8 cigarettes a day, every day. And so just to give you a kind of a concept of how dangerous high radon levels in your home can be, people can get lung cancer from never smoking, but just being in that elevated radon household. Okay, you can. And also this is an interesting recent development where there was a cohort just in the past year that was trying to get some data on radon and increased levels of gestational diabetes. So there has been a correlation. There needs to be more studies done, but there is a correlation between pregnant women who are residing in elevated radon level homes and their development of gestational diabetes. So again, more research needs to be done, but that's just another risk factor if you're in an elevated radon level home and you are pregnant. There's more than just lung cancer that can be going on inside your body. So, and then, so what should you do? So we have developed in the last year the St. Joe County Radon-Free Homes Initiative, because this problem has been around for hundreds of years. Literally in the 1700s, when there were miners in France, they were doing research and conducting data that showed that they were getting this radium and uranium poisoning, and that's linked to the exposure that they had with radon in the mines. And so clear up to a couple of decades ago, the Surgeon General issued a national health warning about the dangers of radon in households across the United States. And it's still kind of a hidden risk that a lot of people don't know about. So we wanted to develop this program to get awareness out, to get education out, and to also provide some tangible help to the residents of our county. So one of the things that we really want to encourage people to do is to test their homes, because you really don't know what your radon level is unless you test it. So the EPA recommends that every 2 years, or anytime you do some kind of like HVAC or home renovation, anything that would disturb the soil underneath your home, you get your home tested for radon just to know your levels. And then if your level is a 4 or above, it is recommended highly that you get a radon mitigation system installed in your home to funnel that radon, bypass it from your home and getting in. If your level is between a 2 and a 4, the EPA does think that you should at least consider what you could do to take steps to lower that radon risk, because unfortunately, even lower levels of radon still can present a risk. And absolutely, if you are smoking indoors, stop doing that, because if your house has elevated radon levels, you're really more than doubling. You're like 10 times increasing your level, or your risk level of getting lung cancer. So we've created this program where we give out free test kits for homeowners. They take the test kits, the instructions are included. It runs between 48 and 96 hours. And the tests that we provide are already pre-labeled, pre-postage. They get sent to the lab that we've contracted with, and the results are sent to us. We follow up with the homeowner and advise them whether or not they need to get a system. And in fact, some of the HFI funding that we've had over the last year or so has allowed us to provide not only free tests, but in certain circumstances, we are able to help with the remediation costs for those homes that need it. So definitely taking action. It's very important to test your home no matter where you are in the county, and to continually every 2 years get that tested. You can advance to the next slide. So again, we have these distribution points throughout the county because 1 in 15 homes nationwide has an elevated radon level, but in St. Joe County, it's 1 in 4. So it's much higher in this area of Indiana even than the rest of the country. And every single home, according to the EPA, it's recommended that you test your home and know your levels, because without it, you don't know what risk factor. You're not going to get that immediate, cough or whatever. It's going to be slow over time. But once your DNA has changed in your lungs, there's nothing you can do about it at the time. So awareness, education, prevention is so critically important. And again, just to put it in perspective, if you take in the United States, the amount of people that die from drunk driving accidents, from carbon monoxide poisonings, from drownings, from fires, put all those together, more people per year die from radon-induced lung cancer than all of those other factors combined. So it's really this silent risk that not a lot of people know about. So that's why we've created this program, to get the awareness out there, get the education, help push people by offering the free test to really take advantage of this. So we've also, again, have these partnerships throughout the county. Mainly our public library system is a distribution point where people can sign up and get a free radon test. But we've also been at local events, health fairs. A lot of doctors' offices have signed on to become distribution points. So we are always interested in getting more partnerships out there, whether it's a church that wants to be a distribution point, a school, another community group that we can, educate them, have them as a distribution point, and get people to take these free tests, get the radon levels in their homes back, and know what to do about it. So that's our system.
We are ready for any questions that you might want us to cover. Is Pam still with us?
She is, but her internet is unstable.
I'm happy to,
Go ahead. I'm sorry.
That's great.
I can, let's get back to where I was. Go to chats. So how do I get out of this one though? Oh, well, start at the beginning and I'll pick it up when I can get there. I'm in a little space. There I am. Okay. I'd like to go back at the very beginning, and we'll start with some questions really quick. Okay.
Okay.
Okay. First, I want to, the first comment was, thank you for the League of Women Voters for sponsoring the Lunch and Talk. I'd like to thank Michelle Migliore and St. Joe County Health Department. You're doing a wonderful job. I appreciate all you do. And she was on her lunch break and she had to leave. Judy Scarbeck. What kind of places are you looking for to support vaccines? And some of this was done when Ashley was here. Some of these questions.
Sure. So we are more than happy to partner with our mobile team is happy to partner with any group that looks to support. Right now, we partner with schools. We have mobile clinics that partner with events. So, various festivals and fairs. We have partnered with the community food, Indiana Northern Food Bank. We have partnered with HealthLink, other local clinics that serve the uninsured and underinsured. So we are always open to partner if we have availability, but we are happy that if you can't catch us at one of our events, which are multiple, that our doors are always open at our brick and mortar building.
Okay. Okay, you're at all the places we are a lot of times. This was from Beth. Thank you to all who are here, your engagement today and every other way you support each other in our entire community. Questions. The things Ashley mentioned, like the support and a lot of the things that she mentioned, the number of schools and how many schools were involved in her program. Are those online?
The names of the schools
And she put it on the chat.
are online, and she did put the Amazon wish list.
Okay, yeah, that.
102 schools in St. Joseph County. All schools, if they request assistance, we help everybody that we can. We've helped them get AEDs. We have a designated school health liaison, and that person is constantly educating schools, and not all schools have a nurse on staff, and so sometimes it's the school secretary.
Okay, and then there were the two, and I clicked on one thinking I was saving it, but it started up. And so I was listening to two things at once, and my brain can't do that anymore. Okay, Ellen asked, how and where, and the same question, how and where are you providing info about vaccine sites and school hygiene needs? And I think you've answered that, right?
Hopefully, yes. We have that information online. We also use all of the community calendars. There are 18, by the way, advertising our vaccination events and any type of public events that we are sponsoring, lead testing, any of the community facing events we advertise on all the community event calendars.
Okay. And the other part to it is if you could send flyers or information to the league, maybe we could send it out to the membership with our regular mailings, and we could distribute flyers to our groups and our churches.
Absolutely. We'll make sure that we keep you on our mailing list.
Wonderful. Thank you. And this was my question. I have a very long memory of some things, not of everything, but how is our current health department being supported by our commissioners and county folks, council?
Yes, the answer is an absolute yes. We have been, they have been very supportive. They have been working with us. It's been a very positive relationship.
Thank you. That's very good to hear. Ellen asked again, do you have sessions for fathers and men who decide to be fathers about the same and pregnancy and pre-pregnancy issues?
So currently, so it's a question for me. So currently, fathers and other support people, we encourage them to come to the classes as well. because overall, we're trying to support babies. So even if like you're a single dad, certain classes could still apply, like safe sleep, car seat safety, and things like that. But we are working on something for next year to try to have specific support to fathers. But as of right now, like the classes, they're open to all parents.
Okay, thank you. Does the lab have to report the lead results or does the ordering doctor or an NP?
So if the test gets sent over to a lab, so for instance, for a blood draw, obviously that is done at a lab, the lab will automatically report that to the state and then we'll receive that. However, if someone like a doctor or an NP, let's say they're doing a test in office for a capillary test and they use the point of care machine that does not get sent over to the lab, then that doctor or nurse practitioner will then be the one that have to report it themselves.
Thank you. And this is silly, but if your house was checked for radon when you bought the house, do you still need to have it checked every couple years? I mean, will you have a problem maybe later to have radon?
Yeah, actually, that could very well happen because radon levels fluctuate throughout the year and soil is always shifting. And that's why, again, let's say you bought your house 5 years ago and the radon level was fine. And in the meantime, you installed some windows or you finished part of your basement or you replaced, several doors. That could affect the ability of radon to get in your home and get trapped there. So it's always good to test it every 2 years because it fluctuates throughout the year. And because things can always change with the soil composition and all of that, again, depending on weather too, it's just really important to every couple of years get it tested just to make sure.
Wow. Okay. Thank you. Cynthia says, whew, that was a lot of information. In fact, it should have been a two-parter, I think. We should have had 2 parts instead of just one presentation because it's almost noon, or it's almost 1. Thank you. Our Department of Health is doing creative, important work despite draconian funding cuts. I wanted to get into that, but we're not going to have time. Low vaccination rates, high lead levels, high maternity infant mortality, and high radon levels in our county. In addition to donating to the school liaison program and voting, are there ways that the League of Women Voters can help?
If you ever have extra food, I know this sounds crazy, but we don't spend, we have a rule that we don't spend any of our funding on food, and we host events like the EMBER program. You have pregnant moms and family members and children that are coming for those educational sessions and support sessions. So if anybody likes to bake healthy treats or wouldn't mind supplying bottles of water or juice, as awful as that sounds, that would be a blessing. So we always are looking for ways to get volunteer or donated food, even if you just want to buy a veggie tray. We're always looking for ways to give food to these events for these moms.
And I will add, if you could spread the word about all our programs within your respective circles, the more people that we are able to reach and educate about radon, about maternal infant health, about the lead program. We have tons of health education and preventative programs at the health department, but we want to make sure that the community is aware of it. So we're doing the best that we can with a small but mighty team, but if you can share this information in your circles, and if there's a point of contact person, we can compile all of our flyers and information to send it to you to share out to your group.
Yeah, and then just one more quick thing about the power of voting and radon. Like unlike the lead program, which there is a state mandate that they have to test and report, there is no such thing for radon, and that's kind of frightening because it affects literally everyone in the community. And it's not a requirement for real estate transactions, that's optional. It's not a requirement for a landlord to disclose the radon level of the home to a tenant. It is not a requirement for daycares or schools or businesses to attest or make students or employees, anything, aware of the radon levels in their buildings. And so if the voter demand is to get some of those actions in place, that would be wonderful. Like at the very least, having it required for property transactions. There's already, you know, some laws in place, some ordinances in place, but to have that knowledge be a requirement when you're purchasing a new home would be wonderful, because a lot of these people, again, it's an unknown risk in our community that a lot of people don't know about.
Okay, two more questions. Are there still free radon kits available at the?
Absolutely, there are. Again, every single library branch in the county through the St. Joe County Public Health or library system, and also the Penn Harris Madison, every branch has a supply of them, and we will continually restock their supply. So for the foreseeable future, we are planning on providing free test kits for our residents.
And now one last question, and that is, what is your address when people want to know where the health department is? Where is it?
227 West Jefferson Boulevard in South Bend, Indiana, 46601. 227 West Jefferson Boulevard.
That was the last question. So we are very thankful that you were able to come today, and Dr. Migliore put you all together here. We asked Dr. Migliore to speak, and we never heard a word from her. She just disappeared and did the screen.
I count on my team. They're awesome, and we will always come back anytime. We've got other units that we can share what they're doing too. It's just incredible what the Department of Health does, and I cannot brag enough. I feel like a proud mother every day. I can't brag enough about my team.
Well, we will take you up on that, I am sure, at another time. And for the ones that were here, for all of you who were here today, thank you so much for not only telling us what you do, but for doing what you do. It's wonderful for our county, and we need you, and we are happy to be in the county with you, and hope that we can do whatever we can do individually and as a league to help you go forward. And for the rest of you all, members and guests, thank you for showing up. Thank you for being here. And next month, come back again on the second Friday of the month. We will have our mayor of South Bend will be our speaker. So with that, I'm out of words.
Thank you.
Thank you.
Bye-bye.
Thank you all very much. I appreciate you. And it's a beautiful day for you to work. Oh, thanks again. Bye-bye.
Bye-bye. Okay.